My name is Daniel Albo. I'm the chair of surgery for the University of Texas Rio Grande Valley, UTRGV for short, here in the RGV.
Are you based always here at this hospital, Valley Baptist Medical Center in Harlingen, Dr. Albo?
So my surgical practice is primarily based out of here, out of Valley Baptist Medical Center, and certainly the majority of the surgical oncology activities are centered here. Our Department of Surgery provides services throughout the valley in other different capacities. But yes, my surgical practice is primarily based in this facility for inpatient services.
And how are things going with the medical school? We're a few years into it now, and everyone in the valley is very excited that we have a medical school. It takes a bit of time to get it off the ground. How would you describe things?
I think things are going great. We just went through a successful LCME site visit for the medical school and meaning accreditation for it. And we are expanding our educational programs fairly aggressively in multiple different specialties in our world, certainly in the world of surgery and general surgery. That program has already produced pretty extraordinary results. We were able to roll out a new residency training program here in Cameron County for starters. That started last year. I started July 1st. We were granted permission from the ACGME to backfill PGY1 and PGY2 positions, 2 residents per year to start. We're about to undergo a prescribed site visit, which we fully expect to pass with flying colors, and after that we will be submitting an application for expansion of that residency to at least double its size to try to accommodate for one of the 2 most important missions that we have for the medical school. Which brings us back to the medical school question. UTRGV was created by the University of Texas with a very unique mission and purpose, and that is to help provide advanced healthcare services and cover healthcare needs for the population of the Rio Grande Valley in South Texas today, but also importantly to help train the healthcare workforce for its future. And in our particular surgical world, that involves training the surgical workforce that it would be necessary to make this a self-sustainable enterprise. South Texas has, much like the rest of Texas, and really indeed the entire country, has a very significant problem when it comes down to general surgical coverage. It's actually one of the most critical shortage areas in all healthcare services countrywide, and in the valley and in South Texas there is a massive shortage of general surgeons. And to make matters worse, it has historically been difficult to recruit physicians and surgical providers from outside the valley, and the average age of general surgeons in the country really, but certainly in this region, is fast approaching retirement age. And so we're having a hard time recruiting them, developing, and then our workforce is approaching retirement age. This is not a good combination of things, which is why we are very excited about the development of the educational enterprise through our medical school in this region. And we rely very heavily on very important partners for us for this mission. In this particular situation, this is Valley Baptist Health System, and particularly this facility here in Cameron County. Valley Baptist Hospital has been an extraordinary partner for us to help us fulfill our shared missions in terms of healthcare services, health services, education.
So you're saying that across the country there's a shortage of general surgeons.
Yeah.
And is the problem even more acute in the valley?
It is, and it's a combination of factors. A lot of that is demographics. This is one of the fastest, if not the fastest, growing area in the United States. The last census, as you probably are aware, we registered at 3.5 million people. 10 years ago, that was 2.5 million people. That is an astounding rate of growth. That does not count, that's only registered voters, peoples. It doesn't account for undocumented immigrants, and even though there's no exact numbers as to the number, it's probably conservative to say that there is at least a 1-to-1 ratio in terms of how many undocumented immigrants we serve in this part of the country. And furthermore, it also does not take into account the number of winter Texans that come and make this their home for anywhere between 6 and 9 months of the year. And again, it's difficult to find precise numbers on that, but I estimate that it's at least 750,000 people. And so if you put all of that together, this is an area that is the size of a medium-sized European country with a population, well, altogether probably somewhere between 6 and 7 million in the catch area that we serve. And we are the only enterprise really looking towards the future of how do we train the workforce necessary to tackle those increasing needs. And so we are in a two-pronged approach, if you wish. One is to aggressively recruit surgical providers into the valley, and we've been very lucky to be able to attract very good surgeons from all over the country. We've recruited altogether in our extended department of surgery somewhere in the order of about 12 providers over the last year. We have several active recruitments still ongoing for different surgical specialties, and this is bringing competencies into the and training into the valley that are very much needed in far-ranging services from surgical oncology to acute care surgery, trauma, and surgical critical care, surgical endocrinology, minimally invasive surgery, and any number of other needed specialties.
So based upon those population figures you just mentioned, can you guesstimate just how many general surgeons we are short of in what would be the optimum number?
My estimate is that we don't even have half of the number of general surgeons that are necessary to cover this large population. And the problem is compounded with the rate of growth because it's actually accelerating. This region has one of the youngest demographics in the country. I believe the average age of Cameron and Hidalgo County is somewhere between 25 and 27 years old. In other words, it's a population that is poised to explode demographically going into the future. And then you layer into the facts the healthcare access and access disparities, especially among minorities, which is a large population of the valley, as you know, probably somewhere between 85+% of the population in the valley is Hispanics. And now you put a lot of healthcare challenges that the region has in terms of very high incidence of chronic conditions, like diabetes is very, very high incidence in the valley, high incidence of cancer, and you put it all together, problems with access, problem with finding specialized providers, and significant challenges in healthcare needs, and well, what you have in your hands is a bona fide healthcare crisis. And we are all collectively working with the medical school and our healthcare partners and health system partners to tackle these problems.
Let's go back to the national scene, though. You're saying there's a shortage nationally as
yes,
well.
Sir.
Why is it that those medical students that want to become doctors, why are they not moving into that particular field?
Well, general surgery training is, best as I can describe it, fairly arduous, long and hard. It requires a minimum of 5 years of training after medical school is completed, and is one of the most demanding specialties in training. Most general surgeons nowadays will complete additional training after their general surgery residency in the form of fellowships, specialized training. And certainly it is important to have specialized surgeons. Of the surgeons that we do graduate, the retention rates in certain regions is more challenging. They tend to leak out, for lack of better description, to what is perceived as potentially more appealing work environments and markets. And South Texas has historically have a problem attracting and retaining physicians. And this is where having a medical school in your midst is handy, is helpful, because it allows you to provide avenues for professional development for physicians that are attractive for career development purposes. And the surgical education environment itself, the career development opportunities within a medical school, it expands your reach in terms of recruitment potential nationwide. And so this is what we are heavily engaged on right now.
So is general surgery, is that perhaps the most acute, where the problem is the most acute, or are there other sort of specialized areas where we have even fewer physicians?
Yes, actually it begins to go downhill from there, actually. You start with a significant problem and it gets worse. Surgical oncology is a very good example of this. Surgical oncology, and when I define surgical oncology, there are now two distinctive type of surgical oncology providers. What is called complex surgical oncology. Think about all of the GI cancers, solid tumors, everything from chest, abdomen, pelvis type of malignancies. That's called complex surgical oncology. And then there is breast surgical oncology that is a more focused area of development for surgical oncology as a field that concentrates primarily on the management of breast pathology, breast cancer in particular. For complex surgical oncology, this was astounding to me. I was recruited as a chair of surgery here. I was attracted, almost intoxicated really, by the uniqueness of the medical school mission and this purpose. As a Hispanic man myself, this resonated very, very strongly with every root on myself of what is happening here. But I came here, and I was going into 2 years, and I was the very first complex surgical oncology, I believe, in all of South Texas history. To my knowledge, there is no other major large metropolitan area, large geographical area in the United States with this type of population without one of us in it. Since then, we were able to recruit a second one, Dr. Jim Cruz, who is also a complex surgical oncology with specialty training in what's called HPV surgery, hepatopancreaticobiliary surgery, liver, pancreas type of malignancies. And we are already actively recruiting additional surgical oncology personnel because, well, we can keep up with the needs of a population where cancer is so prevalent and so complex.
So you've been the chair of surgery.
Yes, sir.
At UTRGV for just a few years.
Yeah, it's going on 2 years. June 1st, 2021 is when
I'm
I
curious
started.
if you have been told the story of before we had the medical school and in the lead up to the medical school, the Regional Academic Health Centre was established. But at some point a few years back, the existing physicians in parts of the valley, not all the valley, were hostile to an idea of a medical school because they thought it'd be too much competition.
Yes.
And yet you're painting the picture here that we are short, which wherever you look, we
Yes.
do not have enough doctors,
Yes, sir.
physicians for the population, for the size we are. And yet back in the day, that was in the news media that some segments of the medical profession didn't want a medical school. Have you heard that?
I heard of that, and this is, I don't believe it's actually unique dynamic to the valley. This has played out in multiple parts of the country, and I understand the genesis of those fears, but much like most fears, they tend not to be necessarily grounded on reality. And the reality of it is that what UTRGV aims to do is to provide gap level coverage for gaps in the healthcare continuum. We don't intend to replace, we intend to augment. And importantly, we intend to hopefully make it self-sustainable because the realities of the healthcare shortages in surgeons is just one of them. Is that if we don't figure out how to collectively improve on that, well, this entire region is going to be in serious trouble when perhaps physicians that were opposed to the idea of having a medical school begin to retire, and you have a hard time replacing them, let alone augmenting the capabilities that they have.
And so did I hear you correctly a few moments ago, you said we have a bona fide health crisis here in the valley?
Yes, sir, we
Can you
do.
elaborate?
The healthcare access has been a problem. The pathology, level of pathology and disease state presentation has been traditionally very advanced. There is very high incidence of diabetes. There is very high incidence of vascular disease. There is very high incidence of renal failure in this region. There is a high incidence of obesity in the population. There is large, very large incidence, very important number of patients with liver disease. All of these combined stresses health systems greatly. The emergency rooms tend to be sometimes overwhelmed by the scale of it all. And so being able to provide those services is critical for the hospitals and the communities that the hospitals serve. And so, yeah, this has been a very significant healthcare issue, epidemiological issue in South Texas for a long time. And as the population grows, it actually becomes more significant, the challenge.
So, apart from giving more money to the medical school so that you could expand and build capacity, is there anything else the state or the federal government can do to help the situation down here?
Well, yes.
Or maybe it's the residents themselves. What can they do to
So it's a multi-pronged approach that is necessary, right? There's no, I believe, no single silver bullet on it. But yeah, there is a lot of things that both at the state and federal levels can happen in terms of how CMS allocates what's called funding formulas for not just for the medical school but for healthcare in general. The reimbursement scales, the care for the indigent population, and who supports that financially through programs like hopefully expansion of programs like Medicaid and Medicaid type programs. We, as a society, not just South Texas, but I believe nationwide, we have work to do to care for the most needy among us. We have not done collectively a stellar job in providing access to those folks. Then there is the local communities engagements, and that I have to say that I've been very pleasantly surprised by the level of engagement from the local community in the Rio Grande Valley. Foundations like the Valley Baptist Legacy Foundation and others have been very critical and instrumental in the support of the medical school and continue to be so. The continuation of that support, or that type of support, is important for the function and the existence of a healthy medical school, especially one that is growing in size and enrollment in numbers. And so there is engagement, much like what you're doing now, in terms of helping people understand what is it that the capabilities that are there. So hopefully they don't have to leave this valley to seek higher levels of care, and particularly in our surgical world. There's virtually no gaps in the services provided that would necessitate somebody, like in the past, to potentially have to leave, go to Houston or go to San Antonio. You see, when somebody has to move for advanced health care like that, it produces some terrible ripples that affect not just the patient, but their families and indeed their entire communities. There is the financial aspects of it, which are oftentimes devastating for patients, bills outside their network areas for which there may or may not be a payment source for it. And people end up sometimes mortgaging their future for generations to provide health care for that type of patient. There is the medical impact of having to do so. Imagine having to undergo complex surgery for cancer and then undergo complex medical and radiation oncology treatments, say in Houston, at MD Anderson or a Baylor institutions where I previously worked. And I have to say, where I actually help take care of patients from the valley at a great number. This is extremely disruptive. And then there is the people that simply cannot do it, either for financial means or because of there's checkpoints. And if you don't have legal documents, you just cannot go through those checkpoints. But yet you still have these complex healthcare needs. somebody needs to help take care
They
of that.
don't make special case. They don't have a special rule because it's life and death that they'll just waive that checkpoint issue.
Yes, sir. No, that doesn't happen. These people actually are landlocked here. And so, but their medical problems don't go away just magically. And so providing care for these complex set of issues here in their home, attached to their communities, their homes, their churches, their civic organizations, with a support structure around them, it is extremely valuable, I believe, for people. And this is literally why we're here for.
Can those patients not perhaps go south into Mexico and get the treatment?
Well, that is an even more complicated issue. Some patients do feel that they need to do that. And, well, there is challenges on that too. Mexico faces a lot of challenges that are germane to countries in the third world. I grew up in a third world country, and I can tell you that there is some significant challenges in healthcare structures and access to a high level of healthcare. And so it's not a solution for them. And oftentimes, they end up getting part of their care on one side of the border and then having continuation of care without proper connectivity that is necessary for the delivery of complex multidisciplinary care of these patients, and particularly when it comes down to cancer and surgery, in particular cancer surgery. This becomes a real problem in a hurry.
I just have one more question about your work with the medical school, and it's probably not an area you specialize in, but I've been so impressed of how in just a short few years the medical school has been building these clinics in the rural areas.
Yes, sir.
So there's a presence. The medical school has a presence not just in the big cities, but you've got clinics everywhere, or it seems to me.
Yes.
Can you speak to that? It's not perhaps your area, but...
This is actually very much our area.
Okay.
It's all of our area. There is no compartment that is exempt on that effort. And it is part of an integral effort of the medical school to serve the entire community of South Texas, and not just the Rio Grande Valley, but South Texas at large. So these outreach clinics and these community clinics, indeed the service in the colonias is also a perfect example for these things. It is a part of how to reach out to the people where they need the care the most, and then to provide access to centers like this one, where we are now, for the kind of higher level care that otherwise they will have a very hard time accessing and reaching otherwise. And so it becomes a connectivity, if you wish, that connects the areas of need with the areas of opportunity up and down the valley. For the more sophisticated, higher level of care that is provided, you need tertiary and quaternary care centers. And fortunately, there is some very good ones in the valley, these here, Valley Baptist being one of them. And so these clinics are critical connectivity pieces for us to connect areas of need with areas of opportunity.
Well, those are all the questions I had related to the medical school itself. Is there anything I've missed out? Anything else you'd like to say about how things are going with the medical school?
Well, I will be very happy to connect you with people that are much more sophisticated than I am for medical school level questions. Everybody from Dean Hawker's office and down through just about the entire fabric of the medical school will be delighted to let you know some of the very, very exciting programs that are happening with our medical school, and we will be very excited to connect you with them.
We'll be very pleased to do that.
Yeah.
Well, thank you, Dr. Albo. That concludes the first part of our interview.
Thank you, sir.